So hello friends, so today I'm going to make a video on the topic of gangrene. So first of all that I'm going to explain you about a definition of gangrene, but before understanding gangrene, so here you should see the normal tissue or the normal group of cells. So here you can see here that in each of the cells, so here nucleus is present, or a nucleus content, or a nuclear content is well developed, a nucleus is present, and here also cytoplasm is well developed, cytoplasmic content is there, and the outer boundary is also there. So this is a normal tissue or a normal cluster of cells. So here slowly like that due to ischemia, so here we know that ischemia also leads to, so here necrosis like coagulative necrosis, liquefactive necrosis, slowly due to ischemia. So here you can see here that this, so here necrosis occur. So here this is the necrosis, so basically coagulative necrosis. So here, and you can see here that the nucleus content damage, cytoplasmic content gone, only the outer membrane is present. So here this leads to necrosis. Now slowly you can see here that in the superficial layer of this necrosis, so here dead cells, so here slowly start to undergo decomposition, and this decomposition of dead cells forms putrefaction. So necrosis plus putrefaction, so here leads to formation of gangrene. So I hope you are able to understand this concept of gangrene. So now I am going to give you the definition of gangrene. So here simply this is a definition: necrosis of tissue associated with suppurated putrefaction, basically because in the superficial layer, so here first that is putrefaction occur. So necrosis of tissue associated with suppurated putrefaction, this is known as gangrene. So now I am going to explain you about so here types of gangrene. So therefore that there are three types: dry gangrene, wet gangrene, and gas gangrene. So first of all that I'm going to explain about the dry gangrene. So here, so friends, just see here that, so this is a normal, so here this is a human body. So here you know that from the human heart, basically from the left ventricle arch of aorta arises, and this gives to different arterial branches, you all know that. And this, so here arterial branches provide, so here provide bloods to all of the body organs and to the distal parts of the body also. Now so here you can see here that in this region, so here you can see that is a blood supply is high, but here that is, and if you go slowly as the, so here towards the distal organs, like towards the, that is so here that is fingers, and also towards the feet or toes, you can see here basically that is the blood supply is slowly reduced, and here, and if, and here this is a normal artery, and if any, so here basically, and you can see here that if any, so here basically abnormality occurs. So you can see here that if any, so here obstruction, like that partial obstruction occurs in this artery, then the blood supply to this, so here toes and fingers is going to be badly affected. And here, and this is just, so here situation when partial obstruction of artery occurs, and here, and this reduced blood supply to, and this reduced blood supply to tissues and feet, so here leads to ischemia. So now I've written that, so here that due to partial obstruction in artery, the blood supply reduced, especially in the toes and feet, and this leads to ischemia. And you also know that, so here ischemia leads to coagulative necrosis, and here, and also due to this also, so here, and this is the main reason why dry gangrene occurs. So friends, so now you can see here that is I have written the definition of dry gangrene also, that is the form of gangrene. So here begins a distal, so here part of a limb due to ischemia. As you know that, so here if any partial obstruction occurs, so here basically the blood supply is going to be firstly reduced in this distal part, that is distal part of the limb, rather than in this part. So therefore that is I have written. and also ischemia occurs, and due to this ischemia also coagulative necrosis occurs, as you know already. And also this portion is written in a book also. I am going to show. And here and now that is, and you should know that in this, that is dry gangrene, that is the amount of bacteria in the putrefaction. So here basically that you all know that this is the putrefaction, and in this putrefaction the amount of bacteria is very less. Now I am going to explain you the reason also. So first of all, that you should know that so here basically that blood supply, so here that is nutrition also. So you all know that, so here basically blood supplies nutrition also. So here, and you can see here this is a normal tissue, a normal tissue where in the cell nucleus, cytoplasmic content all are normal, blood supply is normal, so therefore normal tissue and well supplied nutrition. But here you can see here that in this necrosis, basically that due to this partial obstruction, coagulative necrosis, so here that reduced coagulative necrosis, so here basically that this blood supply is reduced, and here if less blood, then automatically less nutrition. I am sorry for the noise. So therefore that is I have written that, so here blood supplies nutrition to tissues, and here, and you all know that in dry gangrene, so here ischemia develops, so due to ischemia blood supply reduced, so less supply of nutrition. So therefore that you all know that that is bacteria also require nutrition. So here that this is a bacteria, and for surviving that this bacteria must require a nutrition. If no nutrition, then this bacteria will not survive. So therefore written less invention of bacteria, or less a number of bacteria, as bacteria can't survive with the less amount of nutrition. And this is the reason also, that is why is the amount of bacteria invading the necrotic tissue less. So now I want to explain about the gross structure. So friends, so here this is so here case of dry gangrene. So here, and you can see here that this is the affected portion, this is the affected portion, and this is the normal portion. So here, and you can see here that between this so here necrotic portion and viable part, a well line of demarcation seen. So therefore I written that is a line of separation, so here formed between the viable part and the gangrenous part. Now here, and you can see here that this, so here dry gangrenous part is dark in color or black in color. Now I am going to explain the reason also why. So basically, and you all know that is hemoglobin, that is hemoglobin is made up of, so here hemoglobin chain, heme plus globin, and this globin made up of iron, so therefore iron is present in this hemoglobin. So therefore that is, first of all, that is from hemolyzed RBCs, so here so hemoglobin released, and here that is and this hemoglobin liberated, and this hemoglobin, so here and this hemoglobin liberated, and this reacts with, that is hydrogen sulfide, and this hydrogen sulfide also, so here basically released by this bacteria, and this hydrogen sulfide, and here hemoglobin reacts to form black iron sulfide. And here if you want to know how this iron sulfide is formed, as I have already discussed that in hemoglobin iron is present. And here, and this leads to black color, so therefore that is I have written that that is it is black due to, so due to formation of black iron sulfide. So friends, and you can see here basically that is the definition of gangrene. The gangrene is necrosis of tissue associated with superadded putrefaction, and most often following coagulative necrosis due to ischemia. So here types of necrosis, as I have discussed: dry gangrene, wet gangrene, gas gangrene. And here, and from this portion also, I'm going to explain about a dry gangrene. That dry gangrene, so these forms of gangrene begins at distal part of a limb due to ischemia. And here, and why ischemia occurs due to atherosclerosis or thrombosis, these are the main regions and in which her diseases, that is dry gangrene, so here found. And here, and why it is usually initiated in toes, because it is farthest from the blood supply, as I've already discussed. And here, that is, and this is the very important point, it is usually initiated containing so little blood that even the invading bacteria find it hard to grow in the necrotized area. And here, and the gangrene spreads slowly, and this is the part that is a line of separation formed at the point between gangrenous part and the viable part. And here basically why the gross appearance is black in color due to liberation of, so here that is hydrogen sulfide produced by the bacteria, and this results in a black iron sulfide. And here that is, and the grossly the affected dry gangrene part is dark, shrunken and dark black. So that's all about the dry gangrene part. Thank you. And in the next part also, I'm going to explain about the wet gangrene. So here gas gangrene, it is also simple also.